Hello, and welcome. Today we're diving deep into the world of peptic ulcers, a common yet often misunderstood digestive disease. We'll explore what they are, why they happen, how to recognize them, and what can be done to treat and even prevent them. So, grab a seat, and let's get started. So, what causes these pesky ulcers? The primary culprits are Helicobacter pylori, or H. pylori, a type of bacteria that can infect the stomach lining, and the prolonged use of nonsteroidal anti-inflammatory drugs or NSAIDs, like ibuprofen and naproxen. While stress and spicy foods were once thought to be major causes, they're now understood to primarily aggravate existing ulcers. Rarely, other medications, smoking, alcohol, and certain medical conditions can contribute to peptic ulcer formation. Let's break down how these ulcers actually develop. Normally, the stomach lining is protected by a layer of mucus. H. pylori can weaken this protective layer, allowing stomach acid and pepsin, an enzyme that breaks down proteins, to damage the stomach lining. NSAIDs, on the other hand, reduce the production of prostaglandins, substances that help protect the stomach lining. When the protective barrier is compromised, the stomach acid and pepsin can erode the lining, leading to an ulcer. Peptic ulcers affect millions of people worldwide, though the exact numbers are difficult to pin down. H. pylori infection is more prevalent in developing countries and in populations with lower socioeconomic status. The use of NSAIDs is widespread, particularly among older adults, making them a significant risk group. While ulcers can occur at any age, they're more common in middle-aged and older adults. Okay, so how do you know if you might have a peptic ulcer? The most common symptom is a burning stomach pain, typically felt between the breastbone and the navel. This pain often occurs when the stomach is empty, such as between meals or at night. Other symptoms can include bloating, heartburn, nausea, vomiting, and in severe cases black or tarry stools, or vomiting blood, which are signs of bleeding. Diagnosing a peptic ulcer typically involves a physical exam, a review of your symptoms, and specific diagnostic tests. An upper endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus, stomach, and duodenum, allows the doctor to visualize the lining and take biopsies if needed. Testing for H. pylori can be done through blood tests, stool tests, or breath tests. Barium swallow X-rays, while less common now, can also be used to detect ulcers. Peptic ulcers are broadly classified into two main types: gastric ulcers, which occur in the stomach, and duodenal ulcers, which occur in the first part of the small intestine, the duodenum. They can also be classified based on their size, location, and whether they're acute or chronic. Fortunately, peptic ulcers are very treatable. The primary goals are to eliminate the underlying cause, reduce stomach acid, and protect the ulcer from further damage. If H. pylori is present, a course of antibiotics, usually in combination with a proton pump inhibitor, or PPI, and sometimes bismuth subsalicylate, is prescribed to eradicate the bacteria. PPIs and H2 receptor antagonists reduce stomach acid production. Antacids can provide temporary relief. It's also important to avoid NSAIDs, smoking, and alcohol, as these can hinder healing. In rare cases, surgery may be necessary. Prevention is always better than cure. Preventing H. pylori infection is difficult, but practicing good hygiene, such as washing hands thoroughly, can help. If you need to take NSAIDs regularly, talk to your doctor about strategies to protect your stomach, such as taking them with food or using a PPI. Avoiding smoking and limiting alcohol consumption can also help reduce your risk. With proper treatment, the prognosis for peptic ulcers is generally very good. Most ulcers heal within a few weeks. However, without treatment, ulcers can lead to complications such as bleeding, perforation, or obstruction. Recent research is focused on developing more effective H. pylori treatments and exploring new ways to protect the stomach lining. Advances in endoscopic techniques are also improving diagnosis and treatment.